At this point, we're going to turn the conversation over to the capable hands of my
Mm.
good colleague, Robert Bertelink. Rob is a registered kinesiologist and clinical coordinator at Toronto Rehab's cardiovascular disease prevention and rehab program. He's been with us for 26 years. He is a real champion and advocate for high intensity interval training. He'll tell you what that is for our cardiac populations. And he has built a wonderful special program for people living with advanced heart failure. So there's nobody who can't exercise in Rob's mind, and he'll tell us how that can actually work. Over to you, Rob.
Wonderful, Paul. Thank you very much for your presentation, and David as well. Absolutely fantastic. I just want to tie on the last comment that David just made about taking a look at cancer and exercise, and his thinking that down the road, a lot of the symptoms that are brought about by cancer will be able to treat with exercise. One of the things that I always tell a lot of my patients is that we know a lot of chronic conditions can cause problems. Heart disease can cause problems, cancer can cause problems, a lot of symptoms, fatigue, lethargy, and stuff like that. We know that happens with it. But one of the things that always bothers me an awful lot is a lot of people with these chronic conditions, they don't go and exercise. So not only do they have the problems that are brought about by the condition, which are very, very real, but then they layer on top of that just getting out of shape and deconditioning. And I always scratch my head at that. If you've got some kind of medical condition that makes you feel bad, why would you make yourself feel even more bad by trying to get out of shape? So exercise is a really big factor. And I always tell people, I've got the easiest job in the world, because no matter what the question is, my answer is always going to be, yes, exercise is important. You should be looking to do it. So now that Paul and David have made the case that we really do need to make sure that we lead an active, healthy lifestyle, I guess I just want to spend about 15 minutes or so, 10, 15 minutes, just talking about what that could look like. When I think of an active lifestyle, it's really got four components, and these were alluded to by both David and Paul. So an active lifestyle is going to have aerobic components. Aerobic components specifically are to improve your cardiorespiratory fitness. Your heart is a muscle, and we want that muscle to get stronger. And that's what aerobic training is going to do. So that's one component. The second component, of course, is resistance training. Resistance training is very important to keep the muscles going, which helps with your metabolic conditioning, keeping your cholesterol in check, your blood sugar in check, helps with a lot of orthopedic concerns. If you've got arthritis in your knees, making sure you've got good, strong musculature will help with that. So that is key. Promotes independent living, lots of pluses with resistance training. Stretching, third component, making sure you add that into your lifestyle is very, very important. And then the fourth one is making sure that you're moving regularly. Dr. O showed us some really scary slides about the amount of time that we're all kind of sitting down and not moving. We need to do something about that. So these are always the four components. And I encourage you, if you're out there listening to this presentation, to think of your active lifestyle in these four pillars and make sure you're doing the right stuff for each one of those, just to cover all your bases. So let's take a closer look at these. A reminder. So what are our targets? Chronic disease all over the place. They say the minimum amount of aerobic activity that you should be looking to do is 150 minutes. Dr. O showed us this slide, and that's exactly what he said. Also from the cancer side, David showed us his slide as well, 150 minutes, maybe a little bit less for the cancer patients, closer to 3 times 30 minutes, so 90, but you still want to make sure that you're active. So those are our minimum targets that we want to try and get to. So aerobic training, what is aerobic training? So aerobic training is exercise that's done specifically to make your heart a stronger, more efficient pump. Every cell in your body requires a constant supply of oxygen-rich blood to function properly, and it's your heart's job to make sure that happens. The stronger your heart is, the more oxygen-rich blood you're going to be able to deliver. And when you take a look at all those mortality curves that Dr. O was showing us, we know that the more oxygen-rich blood your heart can deliver, the better your mortality is. So how do we go about doing that? Lots of different ways to go about doing aerobic exercise. We've got 4 wonderful examples here, whether it's going out for a walk or a jog, biking, swimming, using stationary equipment. The key with aerobic exercise is to make sure you're doing an activity that uses enough muscle mass that the demand for oxygen-rich blood is going to increase enough that you're going to get a heart rate response. So what the activity is, your heart doesn't really know. I always say, bless your heart, it's a wonderful organ, but it's not smart. All your heart knows is, hey, legs are moving, I've got to send oxygen-rich blood. So whether it's because you're biking, whether it's because you're walking or using an elliptical trainer, your heart doesn't care, it's just going to send the oxygen-rich blood. So you want to pick an activity that you enjoy, that's easy for you to do on a regular basis, and when you take a look at the COVID restrictions, is maybe something that you can do in the current environment. So getting out to a gym, that's not going to be possible. A lot of them are closed right now. We just can't do that. If you're over 70 and you're spending a lot of time isolating, maybe just doing some marching in the spot will work. As long as it gets your heart rate up, you're going to get that training benefit. Generally speaking, with my patients, I encourage them to target a minimum of 30 minutes at a moderate intensity, 5 days per week. 5 times 30 gives us that target of 150 minutes that were mentioned by Paul and David before. And that's as a minimum target. I really do feel the need to stress that. If you can comfortably do 30 minutes 5 times, you really should be thinking about trying to build up to 35 to 40 and 45. As you increase those sessions up to 5 times 60 minutes, the benefits that you're going to get are going to increase. So you want to try, if you can, to kind of bump that up, because there are going to be benefits that you get from that. Now, a lot of times people will say, Rob, you've talked about moderate intensity hard work. What does that look like? So in our program here, I'm very lucky that we're able to do cardiopulmonary exercise testing, where we put you on a treadmill, we cram this tube into your mouth, we measure how much oxygen you can deliver to the working muscles, and then I prescribe exercise in a way of walk maybe 3 miles in 51 minutes. Each lap should take 2 minutes and 8 seconds. We're very, very precise. But we don't have to be. There's a lot of common sense that we can use with our exercise. This is a nice lay description that's provided by Exercise is Medicine Canada, and it breaks intensity down into light exercise. And you can see here, light exercise will usually not cause adults to sweat and breathe harder. So you can go and have a comfortable conversation. Walking is a good example of that. You can go for 30, 45, 60 minutes without any problems, and you're okay. So that's light exercise. As Dr. Rowe had hinted early on, I tend to try and push a little bit more. I'm more of a fan of the moderate intensity exercise for everybody. This is going to make you work a little bit. You are going to be breathing a little bit. You can have a conversation, but you're not talking nonstop. You are breathing a little bit harder, and talking nonstop is going to be a little bit more challenging. You'll start to sweat a little bit. You'll want to take a little bit of a break from your talking just to catch your breath. This is a good level of exercise intensity to target. Remember, your heart's only going to be as fit as you ask it to be. So if you go out for a 60-minute light walk, I mean, that's good. It'll help your cholesterol. It'll help your blood sugar. It'll help your blood pressure. It'll help keep the weight off. All very good things that really help mitigate risk. But your heart's not really going to have to work very hard to do that. And if your heart's not working very hard, it's got no reason, it's got no incentive to get stronger. And once again, it's that stronger heart muscle that's associated with a lot of those mortality benefits. So you got to make it work. You got to give it a chance or a reason to get stronger. So moderate is a good option. A vigorous intensity exercise, what we call high intensity interval training, is something that I'm a big advocate for. For this, you're actually pushing yourself at a pretty hard level. I often tell my patients, if you're doing high intensity interval training and I walk by and I say, hey, Steve, how you doing? Steve should be saying, hang on a second, let me finish this interval. With high intensity interval training and vigorous exercise, you're exercising at a level where you're really pushing your heart at a high level, and you're really pushing it to improve its pumping ability. This is a great way to improve your fitness level. but it can be quite demanding. And I would strongly encourage anybody who's interested in this type of exercise just to make sure that you're clear to do so with your doctor before you really push. As I said, I'm a big advocate of this. I have people waiting for heart transplant, living with mechanical hearts, having had heart transplant and heart failure. And the vast majority of these people, if it's done properly, can actually do high intensity interval training and get some fantastic results. But they do need to be medically supervised for this and medically cleared before they get into this. Knowing that this is a general education session, I really need to make sure that's clear to everybody out there. Okay, so this is one way just to gauge your intensity. And as I said, we should be looking to push for the moderate intensity. If you got clearance for your doctor, vigorous intensity is a good way to go. So moving on to resistance training. So resistance training is also something that's very important. Interesting in our population, I get a lot of people that can get up to 45, 60 minutes of walking 5 times per week with no problem. But getting them to add resistance training seems to be a little bit more difficult. Resistance training is a very, very big part of an active lifestyle, a healthy lifestyle. Pretty much everybody should be looking to do it. The benefits that you get are numerous. I do feel the need just to kind of point out, we get a lot of people that are saying, I want to lose weight, I want to lose weight. You know, people are trying to lose those COVID pounds that we're putting in from that sedentary lifestyle sitting beside the fridge. Resistance training is the best way to try and look at body composition changes. You'll burn more calories in an hour of walking than you will in an hour of resistance training. But the interesting thing with resistance training is your metabolism, the amount of calories that you burn, will stay elevated for upwards of 2 days after that 1 hour's worth of resistance training that you do. And that actually adds to an awful lot of extra calories burned. So body composition, if you're interested in that, resistance training is really something that you should be looking to target. A lot of my older patients are often saying, Rob, I've got arthritic knees, my hip bothers, my back is sore, I can't lift weights, I've got the arthritis. Well, one of the things we know with arthritis is a lot of the time it's a degenerative change as we get older. You know, in your knees, your upper and your lower leg just kind of slide around like this, and that causes the cartilage inside to kind of wear down a little bit, and that causes pain. So a lot of people will say, I just don't want to do so much with my knees because it hurts. But if you work leg weights into your training session, that'll tighten up the muscles around the knee joint. And instead of a sloppy joint that slides around, you'll have a very tight, solid joint that doesn't slip as much. And that will help decrease the wear and tear that's associated with arthritis. So I actually argue with my patients, if you've got arthritic joints, you need to do resistance training more than anybody else because it will help with your joint pain going forward. A resistance training program is really meant, the one that we look at is meant just to provide overall health and wellness. It's very difficult for me to show you a whole bunch of exercises and do them in a 15-minute online presentation, but I do have some resources that I'm going to show people down the road at the end of my presentation. Hopefully you can go and take a look at those resources. I've got short videos that will show you how to do them. So resistance training done 2 to 3 times per week is ideal. Stretching is a big one, especially with so many people with the sedentary time that they're setting inside. So doing stretching is something you can do. You don't need an awful lot of space. As long as you've got kind of enough room to make your arms go, you can get some stretching routine in. Dynamic stretches are stretching with an awful lot of movement. You can see them here on screen. These are 4 dynamic stretches that we get all of our patients to do before they do their exercise. Just some marching on the spot to get the blood flowing, loosen up the hips a little bit, get some shoulder rolls. A lot of people are spending time at their computers doing a lot of typing and whatnot, hunched over keyboards. You get a lot of tightness and a lot of stress in here. So just loosening up the muscles in the upper back, the trapezius, that's going to help. Doing some leg swings to loosen up the hips is great as well, and some ankle rolls. I'll talk about these a little bit when we talk about sedentary behavior, but doing these dynamic stretches a couple of times per day, they're really only going to take you maybe 20 to 30 seconds per activity. 4 of them, it's a 2-minute commitment, maybe twice a day. It's not an awful lot. The hardest part about dynamic stretches, and really the hardest part about all this exercise, is just creating a routine that you can follow on a regular basis. We've also got some static stretches here. These are ones that you can do after you've warmed up your muscles a little bit. We usually encourage patients to do these after the resistance training exercises. Resistance training does, as I say, work the muscles, might cause a little bit of damage to the muscles, which is a good thing, because when that damage is actually healed up, that's how your muscles will heal up bigger and stronger, but stretching will help alleviate some of those symptoms. So stretching is something else that you want to try and do, at least on a daily basis, potentially even twice a day, beginning and end of the day is a good thing to try. Fourth thing that I want to talk about, our fourth pillar is daily movements. We know that sitting for an extended period of time is associated with a lot of negative health outcomes. So you got to get up and you got to move on a regular basis. What does that mean? Typically every two to three times every hour, just get up and move. You don't have to do an awful lot. Just get up and do some of those stretching exercises. I think that's always a good idea. In my mind, when I think of this sedentary behavior, I'm always thinking about snow globes. And I'm not sure if all of our speakers out there are familiar with snow globes. They're these round glasses with these Christmassy, snowy scenes inside. And you shake the snow globe and all the snow flows through this inside of this glass orb. It looks like a nice wintry day. When it's 30 degrees out in Toronto, some people might be wanting to see those cooler days again. But it looks really, really pretty. But then you take the snow globe and you put it back on the shelf and you kind of forget about it. And all that snow kind of settles into the bottom of the globe and it turns into this white, ugly, sludgy mess. And it really doesn't look as pretty anymore. Well, I think of people as snow globes. All right, when we're moving around and stuff like that, that's us shaking the snow globe. And you get all the snow falling all over. It's like our metabolism. We want our metabolism to be active and moving all over the place. This is great. But then if I go and I sit in this chair and I sit here playing like solitaire and I do that for 3, 4, 5 hours, my metabolism is going to get really slow and really sluggish, and that's going to contribute to all these negative health outcomes. So getting up every 20 to 30 minutes, you don't have to go for a big walk. Just get up and walk around the table or the couch a couple of times. That's like shaking your snow globe. And that's going to do so much for your metabolism. And it really doesn't take an awful lot of time. So many people live on their smartphones. Set the timer for every 30 minutes. I got one of my patients who's working hard through these COVID times. I told her to set the timer on her stove. So every 30 minutes, it starts annoyingly beeping at her, and she has to get up out of the office, walk to the kitchen, turn the thing off, because it drives her crazy. But you know what? It gets her up every half an hour. So doing things like that would be great. And I'm going to encourage, if you've been watching my video and you've been sitting for this whole presentation, stand up. Stand up for the next 3 slides, and then you can sit back down. So I said that I would mention a few resources. There's lots of stuff on the internet. Some of it's really good. Some of it is not so good. So these are a few resources that we vetted through our program. If you go to these, we're quite confident that you're going to get good material. For aerobic exercise, there's Start Walking at Home, interval trainings through American Heart Association. Our colleagues at University of Ottawa Heart Institute have got fantastic resources. And as do we, Cardiac College. I'm going to put a big plug in for our resistance training that we have on Cardiac College. They're short 2-minute video clips that might show you how to do a bicep curl, how to do a squat. They're wonderful clips. Go take a look at those, and they'll walk you through a whole bunch of different resources there as well. Cardiaccollege.ca. We also have diabetescollege.ca. They're both lumped under Health University. So you go there, wonderful resources. Okay. There's some other things on starting aerobic exercise programs, the resistance training program, the dynamic stretches. It's all there. Please take advantage of those resources. All right, so just to wrap things up, take a look at all those 4 different pillars of leading an active lifestyle. Think about each one of those and how can you do a little bit for each one of those pillars to support an active lifestyle. Okay, thank you very much. That is it for me, and I think I'm going to flip it back to our moderator, Dr. Paul O.